Good afternoon and welcome to Let's Chat with Dr. Celeste MD. I'm your host, Dr. Celeste Reese Willis. I help busy professionals to find healthcare solutions for both their acute and chronic needs through my virtual medicine program as well as my concierge medicine program. I'm also a brand new author of a brand new book, Vitality. So coming on today to share with you guys just a little update about coronavirus, the novel coronavirus. Hi, Miss Black. Thank you so much for joining. Today, guys, we're going to be highlighting some tips for you to remember when you're out shopping. We're going to talk about some of the changes that occurred or that we're recommending, things that you can help to do for work safety, as well as having a little bit of a discussion about some of the alarming rates that have come in regards to the percentage of African Americans that are challenged with fighting COVID and the deaths that have occurred in that community. Hi, Ms. Hightower. Thanks so much for joining. Hi, Mr. Willis. That's my husband. Thank you for joining. So, ladies and gentlemen, you know that we've been sharing with you over the last several weeks, trying to share with you tips and things that can be helpful for you to help you stay safe right now in dealing with the pandemic with COVID. One of the things that we've talked about is some of the tips that you can practice when you're out shopping. Now, some of the things we talked about last week include making sure that you're doing the social distancing when you're out shopping. If you are out shopping, most stores now, at least here in Alabama, are taking a lot of extra measures to make sure that we're keeping that social distance of 6 feet. That social distance of 6 feet is so vital right now if you have to leave your home to go to the store and to go to other places. So very, very important to comply with that. I've seen a lot of stores that are tape marking off places. I've heard that there are people at the doors of certain stores with counters. They're taking all kinds of measures. So we want to make sure that we comply with those while we're out. Those are things that are going to be helpful for you to help decrease or mitigate the risk of spread of COVID-19, nor of you contracting it while you're out. So we want to make sure that we continue with that 6 feet distancing, whether you're shopping or whether you're in line. If you're around someone and they aren't practicing that, feel free to take, a few steps back and make sure that you practice that yourself to help to continue to protect yourself. You want to make sure that you have some kind of covering over your mouth or over your nose, whether that's a mask or some kind of cloth covering. If you are over the age of 65 or considered a high-risk patient, in other words, if you have a comorbid condition that would make it more likely for you to get COVID, there are a lot of stores that have special shopping hours for you. Most of those stores are opening up early to let you shop when the brand new clean store, or the clean store, not brand new, but a clean store that they've disinfected overnight to help decrease the likelihood that you would get this virus while you're out getting those essential items. And definitely make sure that you're only going out to get those essential items. Now, you want to make sure when you get there that you disinfect your shopping cart. We know that the virus can live on surfaces and definitely on metal for a few days at a time, so we want to make sure that we disinfect it. While we don't know everything about the virus, one of the things that we've learned is that happens. So you want to make sure that you disinfect your shopping cart. Make sure that when you're in the store, do not touch your eyes, your nose, nor your mouth. Please do not touch your eyes, your nose, or your mouth. Make it a point to make sure that you don't. If you can, use touchless pay. There are a lot of places that have touchless pay now where you just put your credit card on top of the machine and it takes it. If you can avoid using money or even using your credit card, then please try to do so. Make sure that you use hand sanitizer the moment that you get in the car and that you wash your hands for at least 20 seconds once you get home. Making sure that you disinfect your groceries as well. We've talked about that a little bit. Now, let's move on to talking about some of the things and some of the changes that they've instituted in workplaces, especially for those people that are considered essential workers. One of the things that they're doing, I know that we're doing this in the urgent care center, is doing a temperature check before the patient or before the employee, enters the facility to make sure that they aren't running a temperature. You can regularly monitor this temperature if you're an employer that's out there and you want to make sure you keep your workers safe. Monitoring that temperature a couple times a day wouldn't hurt either. You want to make sure that you're wearing a mask or some kind of cloth covering as long as it doesn't interfere with your duties. Still practice the social distancing while you're at work. This is something that has to be evaluated on a case-by-case basis depending on where it is that you work. But for the safest measures, practicing that social distancing while you're at work is definitely something that we recommend. Make sure that you're disinfecting and cleaning your workspaces, okay? Doing this on a regular basis. I know when I get in, I make sure I disinfect my keyboard, the computer, my entire area to make sure that it's clean of any germs and that I'm not passing anything or I'm not getting anything passed to me, just in case someone may have missed something. So I encourage you guys to do the same. When you are at work, if you're one of those people that's essential and you have to go to work right now, please make sure that you're not sharing objects with your fellow employees, like headsets. I wouldn't be sharing much of anything with anyone and going to work right now. Making sure that any kind of thing that you have to have for work that's near your mouth or your nose, that especially you want to make sure you're not sharing. That is a potential place that you could transfer the virus. I know that there are a lot of employers that are increasing the frequency of cleaning surfaces. That's something that will help to mitigate or decrease the risk of spread. Some places have considered pilot testing to see if their employees can complete their job without the use, or with the use, of a mask, and it doesn't interfere with the work assignment. That is something that is encouraged as well. You want to make sure that there are employers that are taking measures to try and increase air exchange in a room or a workspace. Part of the reason that they're doing that is because when you're in an enclosed space, this is part of the reason why there's so many people that were on the cruise ships and in different areas or even in an airplane that are getting the virus. It's because it's an enclosed space and there's not frequent or good movement of the air. And so that has shown to increase the risk of spread. So you want to make sure you get air exchange, making sure that you're practicing social distancing when you're taking a break at work. So if it's your time to take a 15-minute break, make sure you're still practicing social distancing. Please don't fall into the normal habit of, oh, I'm just talking to my friend such and such, that you're accustomed to doing. But right now we need 6 feet from everybody, unless there's someone that lives in your household. And definitely don't share food or utensils. And now, so guys, I wanted to touch on a little bit the recent study that was released a few days ago that highlighted that African Americans are suffering with COVID at a disproportionate rate, as well as noticing that there are some deaths as well that are a disproportionate rate in African Americans compared to other Americans that are suffering with COVID. Now, the particular study that was released was of 1,500 hospitalized patients that were positive for COVID. Of that number, there were 33% of them that were African American, 45% of them were white, and 8% were Hispanic. Now, in comparison to the percentage of those cultures that exist, period, in that area, it's disproportionate numbers or percentages. It's a higher rate, basically, of African Americans that are suffering with COVID. Now, 90% of these patients, of the 1,500, had some kind of underlying health condition. 50% of those had hypertension, 35% chronic lung disease, 28% diabetes, and over nearly 50% suffering with obesity. Now, these are comorbid conditions. The most common symptom of that study was cough. Over 85% of patients in that study presented to the emergency room. Their chief complaint was cough. 85% was fever, and about 80% complained of feeling short of breath. Now, that was the presenting complaint when the patient entered the emergency room. Now, essentially, the only direct correlation that we can say at this point, because again, as I've shared with you guys before, there's a lot that we don't know, but what we do know is that people that suffer with underlying chronic illnesses are at increased risk of getting COVID, and as well as suffering complications such as death as a result of having it. Now, it's disproportionate, the number of African Americans that suffer with these kind of comorbidities that have gone untreated. So there's a correlation there, in that, unfortunately, in a lot of African American communities, there are people that go without proper health care, and therefore, without the appropriate health care, that puts you at risk for having a complication. And so, unfortunately, there are African Americans that are suffering with COVID. One of the reasons is because some of them are suffering with high blood pressure, diabetes that may be going untreated. And so that's part of the reason why we've encouraged you guys to make sure that you're taking care of yourselves, that you're making sure you're monitoring your blood pressure, making sure that if you have hypertension, please make sure that you're taking that blood pressure medication. If you don't take your blood pressure medicine and your blood pressure gets too high, you can have a heart attack or you can have a stroke. Both of those things are conditions that make you more likely to get, or make it easier, I'll say, for you to get COVID-19 or put you at an increased risk, we'll say it that way. So treating these things is very important. If you know that you have a history of high blood pressure, please take the blood pressure medicine. If you've run out of your medicine, please contact your physician. Most physicians are seeing patients by telemedicine. I know that I am and several of my colleagues are. If you can't get in with your physician, please make an appointment with myself or your physician. However, you have to get your medicine to make sure that your blood pressure remains stable. I cannot tell you how important that is. If you are diabetic and you're supposed to be on diabetes medicine, please contact your physician to make sure that you start your medicine, restart it, figure out what it is you need to do exactly to make sure that we get you on your regimen so that your blood sugar is not uncontrolled. Patients that are diabetic that suffer with uncontrolled blood sugar are more likely to get infections of any kind, whether it's the flu, whether it's a UTI, whether it's pneumonia, whether it's mycoplasma, whether it's strep. If you have diabetes and your blood sugar is uncontrolled, it's easier for you to pick up any kind of infection. So I encourage you, if you're out there and you're diabetic and you're out of your medicine, call your physician, call them through telehealth. Most physician offices are offering telemedicine services if you need to be seen important. I know that there are urgent care centers that are open all over the state of Alabama, I know, and I'm sure in other areas. If there is a question, please, by all means, make sure that you schedule a telemedicine visit with your physician. If you can't get in, please see myself or any of our colleagues. If you're someone that you have a history of heart disease, please make sure that you're taking your medicine and that you're exercising as your physician has instructed you to, if they've instructed you to do so, and or that you are stable, basically. Taking these maintenance medicines is so important. We do not want you guys to suffer heart attacks or strokes for unknown reason and or have your blood sugar being uncontrolled, because that puts you at risk for catching this virus and ultimately puts you at risk for developing a complication. And we definitely do not want that. We definitely need to have the disparities that exist in our communities addressed with the African American community so that this is not an issue. But right now, what's most important is that if you're out there and you have diabetes or you have high blood pressure, you have heart disease, and you're supposed to be on medicine, that you're on those medications. If you have those things and you have not been treated, then I please implore you to make sure that you get treatment so that we help to decrease the risk of spread of this in the African American community. Now, with that, ladies and gentlemen, I encourage all of you to stay safe, be empowered. COVID-19 is not something that has to handicap or cripple you. I do understand that it's a sensitive time, and there are different people that are dealing with different health issues in their families, plus or minus COVID-19, and I empathize with you. I think that we should all pray for one another, help to support and encourage one another, and try to do our part to help decrease the risk of spread of COVID-19 through our community. I don't feel like there's nothing that you can do. There are things that you can do. So we ask you to continue to do those things, to practice the safety measures, do the social distancing, check on your older relatives, make sure if you're supposed to be on maintenance medicine that you're on it and that you're doing everything that you can to keep yourself healthy and safe. Exercising helps. Do not begin an exercise program unless it's under the supervision of a physician. So that's all I had to share, ladies and gentlemen, today. As we get more information about that, especially about the disparities that exist between African Americans suffering with COVID-19, we definitely will try to address those issues here in this format. So with that, ladies and gentlemen, that's all I have to say, or share with you rather, today. I hope that everyone stays happy and safe. Happy Good Friday. Happy Easter, everyone, and we will see you guys on Monday. Have a good night. Bye-bye.